Hi, greetings of the season. I am Dr. Mangesh Tiwaskar. Currently, I am a practicing physician and diabetologist at Shilpa Medical Center in Dahisar, Mumbai. Now, today I am going to talk to you about some myths which are usually existent in the society for high blood pressure. There are a lot many myths that exist in the society, especially as far as blood pressure is concerned. But when it comes to blood pressure, let's first understand what blood pressure is. Actually, you must be familiar with this terminology of high blood pressure, or which is also called in medical terms as hypertension. Somebody in your family, or some of your friends, or relatives, or known people must be suffering from blood pressure. It's a very difficult problem sometimes if it is left unattended. Blood pressure actually means with every beat, as you know, heart pumps out blood. Now, as heart pumps out blood, the blood exerts an external pressure on the blood vessels. We know that our blood vessels are very flexible structures. They can contract and they can relax with each heartbeat. And that's how our blood pressure is maintained and the blood circulation is sustained throughout. But because of certain reasons, sometimes the heart either forcefully pumps out blood, or sometimes the blood vessels they become too stiff to cause high blood pressure. Now, if it is left untreated, sometimes it can really put a very bad omen on the patient and to his family. It can cause heart attacks, it can cause strokes, it can cause kidney failure. So let's see what are the myths which are commonly seen in blood pressure. The first commonest myth is that blood pressure is not a big deal. You can always leave it. Remember that if you leave it untreated, it is bound to cause problems. It has got a direct impact as far as heart attacks or strokes are concerned. It can cause kidney failure and make you to go on dialysis, or you can become bedridden if you develop a stroke. So how will you prevent this? What is the necessity of preventing this? Number one is maintain a good lifestyle. Number two, do not eat high salt containing junk food. Number three, do not use tobacco in any form. So don't smoke, don't chew tobacco, or do not use tobacco in any other forms. Number four, reduce down on alcohol. Number five, exercise regularly. Number six, sleep well. And number seven, and most important, smile. Have a very healthy relationships, enjoy life, and go for the regular medical checkups to the doctor. If doctor tells you to take an antihypertensive medication, that is blood pressure lowering medication, take it, because lowering blood pressure reduces down the incidence of heart attack, strokes, or kidney failure. Now let's discuss about how do you manage your blood pressure. Now, once you have been diagnosed to have high blood pressure, you will need a treatment. Now, generally, the treatment is in two parts. Number one, which is called as a non-pharmacological management, which is generally a treatment which is without medications. Now, that includes what is called as a therapeutic lifestyle change. You need to change your lifestyle. Now, what are the changes that you will require? First is a good physical fitness. So you need to exercise regularly. At least start walking every day. Now, how much you will walk? It is recommended that for Indians, around 30 to 60 minutes of walk every day for at least 5 days in a week. Or if you want to do a step count, then at least 5 to 10,000 steps every day you can walk, provided you have taken a cardiac fitness for the amount and the type of the exercise that you want to do from your cardiologist or from the treating doctor. The second way is by reducing salt intake. Now, this reduction of salt intake in medical languages is also called as DASH type of diet. So a dietitian will help you in suggesting a dash type diet where you need to reduce down your salt to around 2.5 grams, that is around half spoon of a regular table salt every day. Do not add salt from the top on anything. Number 3 is weight reduction. You need to reduce weight. So sometimes your doctor might ask you to consult a weight reduction specialist on that. Number 4 is do not use tobacco in any form. So smoking cessation, tobacco cessation in all forms is mandatory. Number 5, reduce down on your alcohol intake. Number 6, sleep well. At least 6 to 7 hours of sleep is very, very important. Number 8, last but not the least, de-stress yourself. Smile more. Enjoy life more. Now, this is the way usually the management of blood pressure starts as a non-pharmacological based therapy. Along with it, sometimes the doctors may suggest you to start medications. Now, these medicines are called as the blood pressure reducing medications or anti-hypertension drugs. Now, the doctor will decide the type and the number of the drugs that you require. And doctor also calls you regularly for checking your blood pressure and seeing to it that you achieve the targets. Now, the general target that you all are supposed to achieve, where blood pressure, a systolic blood pressure, which is above blood pressure, should stay in between 160 and 130, and the lower one, which is also called as diastolic blood pressure, should always stay below 90. Remember that managing blood pressure properly, going for a regular medical visits, and following the doctor's advice will always help you in reducing down all the events which can happen because of high blood pressure. Thank you.